Greetings, my name is John. Coming to you from New Jersey, and this is my first YouTube video. And I am posting this because I want to share my journey with you, as I have sought to get as much information prior to a surgical procedure that I'm going to have next week. And that is bilateral total knee replacement. So I've watched a few videos. I wanted to hear firsthand from people that went through what they went through, what to expect, what I could do to improve my recovery and mitigate any of the risk associated with this surgery. I'm 56. I think that's, I don't know, depends on who you talk to. It's kind of early, young for the knee replacement. But then when you look at the spectrum of folks getting knee replacement today, there's young folks and there's old folks, older than me. And depending on your circumstance, there's people that have traumatic injury that require surgery, knee replacement, that don't have like a lead time where I experienced, where I had meniscal tears that brought me to where I am today. So I would say 2 years ago, I experienced meniscal tears. I was moving a shed in my backyard on rollers, PVC rollers. And I don't know, I did something wrong, didn't do what I was supposed to do. But I think coupled with just the wear and tear on my joints through my career and playing the, intramural sports, over time your joints will wear out. I was a huge proponent of taking glucosamine with chondroitin. I did that, I think, even when I was in my early 20s. I would try to mitigate any of the arthritis that I now experience. So a few years ago, I had an issue and I went to orthopedic doctor, and he said, yep, let's get an MRI. And he said, yes, I see the complex meniscal tears. And then I got authorization from my insurance company to do cortisone injections. I did, and the first one, to be honest, the first one I did in both knees, I did get about a month of relief. The first couple days, I didn't really notice any change, but about a week later, I noticed that I was able to walk up and down stairs, and I really wasn't feeling as uncomfortable prior to the cortisone shots. And then I got a second round and then the third round, and they really didn't do much after the first one. And I talked to the orthopedic doctor again, and he said, let's shoot another MRI, and we did. It was a year later. And then you could see the progression, deterioration of the meniscal cartilage, and it was almost gone. And then he said, let's try the hyaluronic shot, and I tried that, and that didn't work for me. It doesn't work for everybody. It might work for some, but in my instance, my experience was that it didn't work for me. I had colleagues that did try the platelet-rich plasma injections, where they draw some of your blood out, separate the plasma, and then they shoot that back into the joint. I found a doctor that would do that. It didn't work. I was very hopeful. I talked to 4 people that had very good, high success with the PRP. So it provided a glimmer of hope for me. And then after 6 weeks, I just, it wasn't going to be successful. So at that point, I was talking to friends and colleagues, relatives, listening to their stories with knee issues, whether it be a meniscal tear, or if they did have arthroscopy, or if they went in for knee replacement. And everyone that had the knee replacement surgery, they all said the same thing, sort of. Most of them were, I should have done this sooner. And a lot of them said, the first 2-3 weeks after surgery, that was pretty rough. You can get through it, you will get through it, but It just depends on how dedicated you are to, getting back up on your feet and moving and, returning to a better quality of life. A lot of friends and colleagues, they all trusted their surgical team, and they all said, "Hey, I recommend this surgeon." That might not work for you. So my advice is, if you are in some sort of condition where your knees have some sort of arthritis, you'll know it. Talk to your insurance company, and then get the authorization to see an orthopedic doctor. And that's the person that will give you the cortisone injections and the hyaluronic injections, and maybe physical therapy might work for you. And then if it doesn't, down the road, once you progress to bone on bone, it's just a matter of time until you make a decision, a medical decision, that your quality of life is important to you, and you want to, do the things that you used to do but are no longer able to do because it frankly just hurts. I wake up in the morning and, oh man, my knees are stiff, and I cannot put my knees together. I have to sleep on my back, which I'm okay. I guess I'm a back sleeper anyway, but if I decide to roll on a side, if my knees touch, the pain is just, it wakes me up. And I don't remember in the last 6 months, a night of sleep where it wasn't interrupted. So it's important that you find a surgeon that will listen to you. You can do the MRIs, take the X-rays. They'll know clearly if you're bone on bone with an X-ray, and they'll recommend courses of action that you can take. Depending on your situation, it might be a partial knee replacement, or it might be a total knee. It might be one, it might not be both. In my case, it's both. So my plan is, I've gone to several pre-admission appointments, talking to the staff at the hospital. I know what to expect. Taken all the blood work. I've done the EKG. I've seen my primary care physician to clear me for the surgery. And next week, I will go in and meet with the physical therapy team, and then I'll talk to the anesthesiologist and surgical team. And I think at that point, I'm guessing they're going to do some measurements on my leg. And then the following Monday, I'll go in for the total knee replacement. I will update this. I want to have, I want to share my experience. So, if you're going through this, at least you'll have some sort of information that might be helpful to you. And I know that my doctors, this surgical team has said, hey, look, if you want to be in the best shape you can be prior to surgery. So a week prior, they want you to stop most of the supplements that you take. In fact, no, they don't want you. They require you to stop taking all your supplements. So anything you're taking over the counter, stop taking it. The day before, they want me to take 975 milligrams of Tylenol just to get that flushed in my system. And then they'll give me a spinal tap, and then they'll do a kind of like a nerve block in both knees to lessen some of the pain. So they say you want to lose weight if you can. So I am 6'1", about 260 pounds. And I'll be very frank and honest, it's hard to lose weight when your knees are compromised. Like, you're not going to go to the gym, you're not going to run. You could do a little bit of upper body work, and you're going to continue eating. So just make some healthy choices in what you consume. If they say stop smoking before you go into a surgical situation, you want to do that. You want your lungs to be as strong as you can. There's a breathing exercise they recommend where you inhale through your nose, you hold it for about 10 seconds, and then you exhale. And you do that, 5 or 6 times, and then you do that several times a day just to improve your lung capacity. There's a lot of risk with surgery, deep vein thrombosis. Let's see what else. Blood clots. They're worried about that. So the better you are health wise, and there's stretches you can do. Your muscle memory that's going to kick in. So there's stretches they recommend. Your toe touches. You want to be able to stretch your feet and bring your toes up, back down. Do leg lifts if you can handle it. I have a pool, and I can tell you right now, it hurts to even swim, much less do any kind of leg lifts in the water. Just that joint is just really not in a good position. So I will update this again next week. I will go in to do my final pre-admissions. I'll do another upload to discuss what was or share what was discussed at that meeting, and then after surgery, I don't think they're going to let me take this into surgery. I'm pretty sure they won't, but I will be there. I'll do a video probably the day of going into it, and then afterwards, after surgery, getting into the physical therapy, and then when I return home. I know I will spend the night in the hospital the first night. I'm expecting that. It's already been arranged, so there's no surprise here. Just have open communication with your surgical team, and you just ask all the questions that you need to fully understand the surgical procedure. So again, August 28th, I'm having bilateral total knee replacement. I will update this, and I hope that I can be of assistance to anyone who is possibly considering going down this path. That's it for now.